For my periodontal probe skill assessment, my armamentarium needed is my full PPE, gown, mask, goggles, gloves, my 3 different types of probes, and my mouth mirror and dental floss. The 3 different types of probes, the Marquise probe is color-coded and has 3 millimeter increments from 3 millimeters up to 12 millimeters. The UNC 12 probe has individual millimeter markings 1 through 12. And then the Neighbors probe is used to measure furcations. The Marquise probe is a double-ended, unpaired sub- and supragingival assessment tool. It has a simple, flexible shank that is circular in cross-section. It has a blunt, rod-shaped tip with no cutting edges. We use the Marquise probe to assess the health of the periodontium, to measure recession, conical attachment level, and width of attachment, bleeding points and suppuration, measuring extraoral and intraoral lesions, measuring the mucogingival relationships, and monitoring the longitudinal response of the periodontium to treatment. I would then ask my patient if they have a history of gum disease or periodontal disease, or if they have any concerns today with their gum health. To measure gingival recession, you first locate the gingival margin in its relationship to the CEJ. All 6 zones of the tooth you measure recession, and anything over 1 millimeter is recorded for recession. I would then check for frenal involvement, so completing the tension test, I would pull on the patient's upper lip and lower lip to check the frenum attachment. If the frenum is too far attached or too high up on the tooth, that can cause gingival recession also. For measuring the width of attachment, you locate the gingival margin in its relationship to the mucogingival junction. You would get an extraoral reading from the gingival margin to the mucogingival junction. For example, if that was 6 millimeters, you would then take your probe depth, say that was 3 millimeters, and then you would subtract the probe depth from the measurement from the gingival margin to the mucogingival junction. Anything less than 2 millimeters is considered inadequate, and then anything less than 1 millimeter means that there is no attached gingiva. To test a tooth for any mobility, you would take 2 blunt-ended instruments. So in our case, we would take our mouth mirror and then our cotton forceps. You would apply equal pressure to both the buccal and the lingual sides. Class 1 mobility is less than 1 millimeter of facial to lingual displacement. Class 2 is anything over 1 millimeter but under 2 millimeters of facial to lingual displacement. And then class 3 mobility is anything over 2 millimeters of facial to lingual displacement, and the tooth is depressible into the socket. To measure furcation, you would use our Neighbors probe. There are 4 classes of furcation. 2 of them you can see on x-rays, being class 3 and class 4. Class 1 furcation is you can see the concavity, feel the concavity, but your probe does not go through over 1 millimeter. Class 2 is your probe penetrates over 1 millimeter. Class 3 is the probe can pass through the furcation, but it's not visible in the oral cavity. And then class 4 is it is visible in the oral cavity and your probe passes all the way through the furcation. And then lastly, we would check the conical attachment level. If there is any recession, you would add your recession to the pocket depth number that you get. If there's gingival overgrowth, you locate the CEJ, and then you would subtract the that distance from the gingival margin to the CEJ from your probe depth that you get. To check for mobility, I would use two blunt-ended instruments. So in this case, cotton forceps and my mirror. And you just apply equal pressure. So if I got a 6 millimeters from the gingival margin to the mucogingival junction, and then I got a 3 for my periodontal pocket, my probe depth or my periodontal pocket, then I would subtract the two, so 6 minus 3 would equal 3. That would be the width of attachment. After I complete all of my probing measurements, my recession, I would evaluate for open contacts with my dental floss. And then the last thing is maintain asepsis.